Hey guys, so today we're going to talk a little bit about bloodborne pathogens, and this will be actually be your yearly in-service. I thought this would be a quicker way to talk to you guys rather than having you all come in and sit for a meeting. So I'm going to need you just to listen to this. The handouts will be attached as a PDF attachment to the email, so make sure you print those and view them as well. And then I'll need you to come by either Monday the 29th or Tuesday the first and sign the sign-in sheet verifying that you have viewed this video. So I'm going to go ahead and get started. So there's one handout, but it's two different parts. The first part is a handout from a PowerPoint presentation, just 3 slides. And the second part, which is just all one attachment, is actually our exposure control plan from the policies and procedure manual. So I'm just going to go through this. It's not going to be too long. Of course, if you have any questions, just feel free to come see me in the office. I should be here all week. So the first thing we're going to talk about is actually the policy and procedure. It's infection control policy IC.2, okay? And so this is actually a required policy for our state and federal regulations. Um, this is actually the exposure control plan for all hazardous materials, but we're specifically today going to cover the bloodborne pathogen parts of this. Okay, so this plan is actually reviewed and updated annually. There are several different parts to this. Obviously, the agency has the responsibility to protect our employees from exposure. So we have to do certain things like provide personal protective equipment to you guys and safety systems such as needleless IV systems and those sorts of things. But specifically today, I'm going to talk to you guys about the staff responsibilities and the things that you guys are responsible for. Obviously, one of them is to attend a yearly in-service. Um, Another responsibility you have is to notify the agency or myself of any special needs related to PPE, otherwise known as personal protective equipment. Things like if you need extra large gloves or splash masks with splash guards on them, those types of things. Your responsibility is also to appropriately implement the PPE, engineering controls, and work practice controls to decrease your risk of exposure. So we have the burden to provide it to you. You have the burden to actually put it into use. You also have the responsibility to notify us if there's any default in this PPE system or engineering controls, like if the self-sheathing needles do not work, that kind of thing. And you have to notify the appropriate supervisor of any exposure occurrence or symptom manifestations of TB. You all sign a form every year at your yearly eval talking about that you're not having any symptoms of tuberculosis. Um, Okay, so if there is an exposure to a bloodborne pathogen, such as a needle stick or a splash, something gets in your eye or your mouth, obviously that's something that would need to be reported to me immediately. We'll have to do an incident report. There's some OSHA paperwork we have to do as well, and we'll consult with our medical director regarding the appropriate medical follow-up for those things. We actually did have a couple of needle sticks a couple of years ago, and there's some testing that has to be done, some consent we have to obtain from the patient that the needle came from. So obviously it is super important that you report that to me ASAP. Like, do not stop, do not pass go, do not collect $250. Call me immediately if that happens. One of the things that this exposure control plan actually does is it identifies um, the jobs and functions that are the most at high risk for exposure. Obviously, nursing is going to be at the most high risk for exposure. We deal with things like Foley catheters and collecting urine and lab draws and starting IVs, and so those things are obviously going to put you at the most risk for an exposure to bloodborne pathogens. Our therapists and our medical social workers are also at risk for this as well. You guys don't deal with this quite as much, but you therapists are actually in there with your hands on the patient, so there is always the risk of some exposure to some bloodborne pathogens. Activities that are considered high risk would be blood sugar checks, any and all venipuncture, any intravenous procedures, PICC lines, portacaths, those kinds of things. Changing dressings where there's draining wounds, removal of fecal impactions, emptying or changing any drainage bag, a Foley bag, a G-tube, JP drains, those kinds of things. And bathing of patients with excretia on their skin or from draining wounds. Our home health aides are actually at risk too. One of the major parts of this exposure control plan is the discussion regarding standard precautions. All employees will be provided with the appropriate equipment and instruction on the required guidelines through the use of in-services and written protocols. Okay. Obviously, proper hand hygiene at the beginning and during the visit is an important part of standard precautions. You should wear gloves whenever there's a reasonable potential for contamination. Obviously, if there's any chance that there could be a body fluid or blood involved in whatever you're doing, you should always wear gloves. You should use face mask, eye protection, and disposable gowns when the potential for splashing of blood or other infectious materials is possible. Any healthcare worker who has cuts, abrasions, puncture wounds, a hangnail must wear gloves at all times during patient-client contact. Any surface which has come into contact with blood or any other potentially infectious body fluid should be wiped down with a bleach solution. Our microkill wipes do meet the standard for that. All sharps will be left uncapped and disposed of immediately into properly labeled containers. If a needle must be recapped for safety, the one-handed scoop method is to be utilized. That's where you lay the cap down on the table and you take the needle and you scoop it into the cap. You never put two and two together because that's usually where the potential for the stick happens. Ladies, when you put on your mascara, how many times have you run that wand down your finger thinking you were going back into the bottle? So all sharps should be uncapped. If absolutely you have to recap it, do it with one hand. All my nurses should have a biohazard sharps container in a little bag that it attaches to. Obviously, if it gets full, you're to seal it up and close it up and put it in our biohazard box back there. And there's new ones back there in that biohazard room in a little box that's labeled empty sharps containers. So you should not be putting recapped sharps in there. That's a really dangerous thing that you should not be doing at all. One of the things that happened a few years ago was a nurse had actually, I'm not sure if she dropped it or put it in there, she put an uncapped finger pricker for checking blood sugar or PT9R back into her bag, and she stuck her hand when she stuck her hand back. She stuck her finger when she stuck her hand back in her bag. So obviously, we should never be putting anything open in your bag. It should only be going into your sharps container. Let's see. Some of the engineering controls that we have in place to protect our employees are self-sheathing needles. So our needles have a safety slip that you activate to cover them. Needleless systems, and sharps with engineered sharps injury protection. All of our biohazard containers should have a warning label affixed to them as well, and red bags or containers marked with the biohazard symbol should be used whenever transporting things that have blood or body fluids on them. We do have a sharps protection program, and it's mandated by OSHA that we have that. And basically, it says that we have to provide needleless systems and sharps with engineered sharps injury protections for you guys. So we do the majority of things that we can on a needleless system. Sometimes we do have to use needles on IM injections and for venipuncture, but we're going to try to do things safely as possible. And we try to keep those things up to date as the technology changes and use the most current things. We do have a sharps injury log. It's mandated by OSHA that we have that. So if you ever need to see that, I have that in my office. It's in the infection control plan notebook. All patients, all employees are issued PPE that should be carried in their bag, including hand sanitizer, gloves, gown, mask with an eye shield, a CPR shield, and a spill kit. So all of those things were actually just updated and given to you guys, so you should need to be carrying those in your bag at all times whenever you're providing patient care. Obviously, if we have somebody that has bird flu or H1N1 or TB, an active TB patient, we're going to have N95 respirators, and we do have those in our agency, but we would have to fit test you guys if we had that happen, a patient with that kind of thing. Universal precautions and safety measures, we've touched on that. Basically, standard precautions is that you wear gloves and you use that PPE with those engineering controls anytime there's the potential for the exposure to blood or body fluids. Main thing is that you guys use those things that are put into place. If you will use those systems and those items, um, you're going to be safe from an exposure. Obviously, if there is an exposure of some sort, a needle stick, a splash, or a spill on one of you guys, then I need to know about it. We'll have to do an incident report and do follow up. So if you have any questions, come see me. That should be it. Please make sure that you print out those handouts and you review that policy and procedure. And then I need you guys to come sign saying that you have viewed this in service. So hopefully this was quicker than having you all come in. If you have any questions, come see me. Thanks, guys.